the heart failure in Indian patients differs from the world statistics in the form that what we see in India is actually the younger patients who are suffering from this heart failure. In fact, when we look at the Western population, it is generally the people who are about 60, 70 or elder who are seen as heart failure patients in their clinics or in the hospital. But in India, we see it at much earlier, that is about 20 to 30 years younger patients are seen to be suffering from heart failure. In fact, in India, the problem of uncontrolled blood pressure, uncontrolled diabetes, heart attacks is much more, and that affects the heart pumping to a greater extent, and we are seeing the younger patients. Besides, in India, the problem is many people cannot reach the diagnosis because the facilities are not available in many health centers, healthcare facilities. So the diagnosis itself gets delayed and the patient comes to the knowledge of this condition much later. Then whatever the recommended medications are from the world point of view, most of those medications are not prescribed because of lack of knowledge, and finally many of these medications are very expensive, and so people try and avoid taking those medications. That all these factors contribute to poor prognosis, especially in younger population. So in India, what we need to do is have regular health checks, especially the symptoms which are suggestive of heart failure should be progressively or correctly investigated, interpreted. The medications should be started early. Although the medications are a little expensive, but these are the things which reduce the mortality, allow the patient to function for a much longer period. That's how the income will be still generated for the patient, and the bad prognosis can be prevented or delayed at least.